Birdman, time again for Community Shout here on the Arizona White Mountains podcast. And yeah, I hope everybody's washing your hands because, you know, this is going to be the coronavirus episode. Got with me today, how you doing? Mr. Kirk, Webb?
Doing great, thanks.
Timber Mesa Fire and Medical, and that's
right.
why we're bringing you. So what's your level of people afraid they have the coronavirus calls at about right now?
You know, it seems to be escalating. I honestly don't even know. I know just the other day we had several calls to one facility, and it's almost like, okay, you know, because what we're telling people is if you're feeling sick, stay home. You know, it's that simple. So, you know, and honestly, working with CDC and health departments, the best way to treat the coronavirus is washing your hands, like you mentioned.
Preventatively, yeah.
Exactly. You know, and not just going like this and for 10 seconds, you know. You got to make sure to get in between the fingers, and, you know, that friction is actually what helps get rid of those germs that you get on your hands, and using antibacterial soap.
Yeah.
You know, I know a lot of people are saying hand sanitizer, but that's not the cure-all.
But that's not the cure-all. So actually what you want to do is get soap, and you wash with the soap.
Warm to hot water.
Yep, warm to hot water for 20 seconds or longer.
At least, you know, like we tell the kids, sing your ABCs twice, or happy birthday. You know, hey,
happy birthday.
Happy birthday's a good one. Sing that 2 or 3 times. We all like to have birthdays, right? Well, second one, we got too many. I'm starting to get on that side of things, you know.
So, but the key here is let's not freak out, because the freak out's actually causing more harm. And so I was watching this morning, they were doing the hearings for the CDC, and the CDC's like, you know, one of the congresswoman was asking, you know, what's the treatment? What are you telling them to do? Well, what we want them to do is go home and stay away from people.
Right.
Okay. She's like, well, yeah, no, but how do they get better? She goes, well, you know, they drink water, they should have some soup and maybe some orange juice and just relax.
How do you take care of a common cold? Same thing, you know?
Yeah.
And if you're feeling sick, use up your sick time. Go home.
So the big panic that came out of the fact that China had a whole bunch of cases and it exploded is they're very packed in tight there. They didn't have doctors there. So they had a whole bunch of area where we've got a good hospital here, but honestly, don't overwhelm the resources, because there's people out there right now that are having heart attacks. There are people that are falling and they're injured that are going to need help.
Right, true emergencies.
Yes.
You know, and one thing that's really kind of cool with our Summit Healthcare, they have a thing called telemedicine. You can call in. You don't even have to leave your house.
Right.
You can just call in, talk to a doctor. They can look at you, and they can, I think they can even prescribe medications.
So help me out here, because you're kind of a professional. I may not understand. What does this do for the coronavirus?
You know, that's just for people that are full of crap. I'm sorry.
Yeah, I don't
I don't know.
really,
Maybe I shouldn't have said that.
I don't
know.
understand what the run on toilet paper was about. And I've seen videos where people going into Costco running and grabbing like 5 or 6 packages, and I'm like,
Even locally, it's
it's wiped
getting
out.
Hard to.
This is the first time I've ever seen that the entire section was empty at Walmart. I was like, wow, wiped out. Yeah,
That's another. You know, maybe we should.
Wiped out. Ha ha ha. So, anyways, yeah, just
You know, because even the masks. You know, we're telling people, you know, wash your hands is the biggest. Maybe, and this one's been tough for me, handshakes, because I'm a guy that I like to greet people with a handshake. But you know what? That's one way to transfer germs.
Here's how it works. It's direct skin-to-skin contact, or people sneeze and you get it on your hands, and then they touch their face, okay? So the touching the face is bad. Now, you'll see people with masks, and the doctor DJ guy that does this stuff online, I was watching him the other day, and he's like, look, he goes, if you're not sick, and you're not trying to keep your sickness contained to yourself, which is what a mask is for. It's not to keep you from getting it from other people. If you're not sick and you're wearing a mask, you're just being a jerk. So just relax. The mask is really, and one of the things is if you put a mask on, you won't touch your face. But what happens is if you don't wear a mask all the time, it's like wearing a helmet. Your nose itches, so the next thing you'll be doing is touching your face more.
Yeah, and you know, and I've seen some of those. I don't know, it's not the YouTube videos that kind of like, what's that show that they try to prove everything wrong or right?
Mythbusters. Yes.
Mythbusters, that's it. You know, I've seen where they, you know, how far does a sneeze travel?
Right.
You know, and MIT and all those different places have done studies, and in some cases it can travel, 75 feet. I mean, that's a That's a long way. So
Cover your mouth.
right, and so we're telling people use a Kleenex. So maybe that's where the toilet paper comes in.
So I've got a 2.5-year-old, so it's basically everything I've been telling him for like since he's been able to understand language is wash your hands, brush your teeth, cover your mouth when you sneeze,
Right.
all these things.
Yeah, and so if you're feeling sick, don't go in public. You know, maybe avoid big crowds. You know, things like that. But it really is very simple. And in fact, even over in China, they haven't had that many deaths as compared to some other, you know,
In
just
a
a
certain
regular.
area they did because they got overrun by services. And that's the issue. is
Right.
We don't want people dying of other things because the services are being overrun from everybody going, I've got a cough.
Right.
What should I do? Is it coronavirus? Can you test me?
The ones that are really affected are those that have a weakened immune system. And typically the elderly. They're even saying, I've been reading in the studies I've been looking at and reviewing, even the young are not even really
That's
as
why
affected.
you're seeing that it's coming out of the nursing homes. So.
Right. So just, I mean, simple precautions and stay healthy. You know, eat right, get plenty of sleep, wash your hands. You know, and you know, granted, I mean, I think we should have been already washing our hands anyway.
The big thing they have, we'll put up this other things. They say, you know, avoid close contact, cover your cough or sneeze with a tissue,
Right.
and then throw the tissue in the trash.
Yeah, directly. Don't put it back in your pocket. You know.
Avoid touching. Remember when we used to do that? Did you do that?
My dad still does.
I can't believe I used to do that.
He has
Like we had a tissue,
handkerchief.
a handkerchief. Ugh.
Yeah.
Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched surfaces, or don't frequently touch them. Stay home when you're sick.
Right. You know, and
wash your
in,
hands.
in the bathrooms, in the kitchens, and things like that. Use those Clorox wipes. You know,
Yep.
disinfect everything, and just stay healthy and wash your clothes. And
Cool. Okay.
it's really simple.
Well, thank you very much for that. Anything else that we need to be being aware of?
You know, I'm ready for springtime. What the heck? Mother Nature's just teasing us with these warm days,
Yeah.
and then next day it's like trying to snow and rain, and warm days. It's like,
It's almost like nature's trying to make us sick. Imagine that this
know.
time of year. Anyways, cool. Thank you once again. I'd shake your hand, but I'm not going to.
I know we do that.
Yeah, I'll just say hi.
Yeah. Well, and in fact, there's in sign language, this is hello,
Oh, hello.
or the my favorite is because you know I'm Captain Kirk.
Yeah,
you know,
yeah. Live long, yeah, prosper.
Live
Very
long.
good. Hey, it's Kirk Webb with Timber Mesa Fire and Medical District. Thank you very much for your time. Hey, that's going to be it for this week's episode of the Community Shout here on the Arizona White Mountains podcast, brought to you, of course, by the town of Pine Top Lakeside. I want to thank everybody out there, and oh, by the way, also the White Mountain Partnership. I want to give a shout out also to Rain. Make sure you check out their logo that was in the beginning, and then also the link we have to them as well. That's the Rural Area Innovation Network for STEM learning. So, you know, we need to get that out beyond just kids and into the adult segments as well. I'm Birdman reminding you, if I don't see you around town, I'll catch you right here on the web.